Good morning, and my name is Stephanie Patton. I'm the principal of Columbus City Preparatory School for Girls, and we are beyond excited today to welcome our partnership with City Councilwoman Brown and the City of Columbus and Columbus City Schools to give access to our young ladies for menstrual supplies and products and to eliminate the stigma. So we are definitely excited, and we want to introduce to you the things that we are going to do this year at our school, Columbus City Prep for Girls, and in our collaboration. So with that, I will introduce City Councilwoman President Brown.
Thank you so much. Thank you so much, Principal Patton. I'm Elizabeth Brown. I'm the Columbus City Council President Pro Tem, and I am thrilled to be here today. I am so excited for this partnership with Columbus City Schools. I want to say a couple thank yous before I dig into my remarks. First and foremost, thank you to Superintendent Dixon, to Dr. Dixon, for your leadership and bringing us here today. This is just incredibly exciting, and we're making a real impact on girls. And when I see your leadership coming into the district, I know that that's what you're thinking about. What's my impact on individuals? You've got a whole big system to run, but I know that you're putting the student first and the individual first, and that's powerful. So thank you. I want to thank Kate King. Without you, this couldn't happen. And I want to thank Principal Patton for hosting us here and opening your doors for this pilot. I also want to acknowledge Lois Carson, who is here. She is the president of the Columbus OPSI, and you are going to be working with your union members, the custodial staff, that will really be making sure this pilot is a success, that it works for the girls, and that it works for the staff, because it has to work for both. So thank you for being here. The way that we acknowledge and accommodate menstruation needs to change. Currently, there's a stigma associated with periods because we don't talk about them. You know, I've said this before, but I firmly believe it. If men had periods, there would be tampons and pads in every restroom alongside toilet paper. Men have written the rules from really the start of our culture and society, and I actually think this is a good analogy when we're talking about trying to create a more equal society. And we need to start talking about an equitable society, right? And this applies to a host of ways that we need to live up to the values that we should espouse as a nation. But I'm gonna use the analogy of periods here. So equality is providing toilet paper to everybody, right? Everyone needs toilet paper. That's equality. But equity is recognizing that different people need different things, and we need to be there for the needs of every individual. And equity is providing toilet paper for those who need it, and tampons and pads, menstrual products, for those who need it. Can anyone here think of a restroom outside your home where you're expected to bring a roll of toilet paper? Hands? No. No one, right? Is there any restroom outside your home where you're expected to bring your own roll of toilet paper? That is unlikely, but it is the case that almost any restroom you go to, you're expected to bring your own menstrual product. And that needs to change, because just like going to the bathroom, a monthly period is a normal bodily function. And in fact, free toilet paper, even soap, toilet paper covers, are often provided in restrooms, and we need to make sure that tampons and pads are the same. The City of Columbus is doing our part to change the stigma around periods as well. In 2017, the city launched a pilot program to provide free menstrual products in our recreation centers. We started with 8 rec centers. Earlier this year, we provided funding to expand that to restrooms in all 29 city rec centers. And this morning, we are announcing that the city will continue this work by expanding access to free menstrual products, citywide in our municipal buildings. Products will first be added in restrooms in downtown campus buildings, City Hall, Michael B. Coleman Government Center, Police Headquarters, 77 North Front Street. And our goal will be to continue from there until every municipal building has free and accessible tampons and pads in the restroom. Through this work, we're taking critical steps forward in the effort to improve menstrual product access. We're fighting the stigma that has for too long precluded a conversation about this basic need. Menstrual products should be no different from toilet paper, and we are doing our part to make that a reality. And the fact of the matter is, I was reminded, I was on a panel earlier this morning with a group of women, and we were talking about this announcement that was to come. And one woman reminded me that menstrual product access is actually also good for business. You're seeing a lot more businesses do this because it demonstrates that they have an understanding of equity. And it demonstrates that kind of leadership that we have come to expect in Columbus. We have to be the change that we want to see. So thank you to the Columbus City Schools for being the change that we all want to see. You can tell in sort of how I got up here with just effervescent excitement, how thrilled I am to have the partnership of Dr. Dixon. And I also want to acknowledge that school board member Shauna Gibbs from the start has been an advocate for this change too. I'm so glad you are here to celebrate with us this important pilot project and really demonstrating how the city, we're covering all 29 of our rec centers, and we're gonna get to all of our municipal buildings too, so we'll have citywide access. But I think that one of our messages here is no matter where your kids are, if they're in school during the day, your girls, if they're in school during the day, or if they're in the rec centers on the weekends and the evenings, we've got them covered. We're here to fight back against that stigma and make sure that all girls have the products they need in the restrooms. With that, I will turn it over to the wonderful Dr. Talisa Dixon.
Thank you so much, Pro Tem Brown. I want to acknowledge and say thank you to the city and thank you to you. This was her idea. She brought this to the district, and that's why it's so important that we strengthen our partnerships. We do not want to be the entity that says no to partners who want to do something different when we're serving our students in our city. You ask, we said yes. The principal Patton said yes. The school nurse, the supervisor said yes. Dr. K. King, we said yes to the opportunity to remove a non-academic barrier for our students. And that's what we want to do, to make sure that our students have what they need when they need it. And this pilot opportunity would give us the supports that we think the students would need, one, and for us to monitor the amount of products our students are using so we can go back and look at our data and say, where do we want to expand next? So we are ready for this opportunity for our girls. Our girls deserve this. They need these products. And Columbus City Schools will continue to support and strengthen our partnerships in various ways. And this important partnership is important to us because our students are important to us and important to the city of Columbus. So thank you again. And next, I would like to bring up our Director of Health, Family, and Community Services, Dr. Kate King, who will provide some additional information for us. Thank you. Thank you. Thank you.
Good morning. As the Director of Health, Family, and Community Services, I supervise the school nurses who provide health care, health counseling, and health education in schools. School nurses are the experts in doing that in our school district. And while for more than 40 years we have provided menstrual products to all of our students at no cost, this opportunity with Councilwoman Brown and the city gives girls another access to accessing those products where they're needed, right in the restroom. We continue as school nurses to provide health education to our students about their changing and developing bodies. And we're going to continue to do that, but this project also allows us an expanded opportunity to do that to more students at upper grade levels. We'd like to give them the education of how their bodies are changing, what to do with these products. We also work hard to identify gaps of health care for our students. And one of the gaps is that it is difficult to get menstrual products outside of a school building. School nurses link families with community resources so that they can get menstrual products at no cost at free stores and other community centers so that it's not a burden to have those products at home. I thank you for this opportunity and look forward to providing the best care for our Columbus City School students.
I'm going to close it up there with a couple more thank yous. Again, Dr. King, thank you for that, your important words at the end. And I want to point out that the integration of school nurses into our students' daily lives is so important because health is really bedrock to how a student can be successful. And so you've seen the way that they designed the machine here, a reminder to girls that they can ask a nurse if they have a question about their period or about the products themselves. And I think that's so important. And I have a hunch you had something to do with that messaging on there, Dr. King, so thank you. And Principal Patton, as I've said, we are in this, if there's anything that your girls need or any kind of conversation we can have together, we want to do that. And Dr. Dixon, again, the first time that I sat down with Dr. Dixon, we were talking about all of the wonderful ideas she had for the district, and she asked for my input, which was incredible. And this was what I offered up. I said, this could be a really good thing for the girls in your district. And so to see you take that from a conversation to action is incredible. We are glad to be doing our part at the city. And I just, in closing, want to hone in on one thing Dr. Dixon said, which is that this is an instructional issue for kids. This is a classroom issue. Because you think about being a girl who started her period. In those first few years, you still don't have a handle. You may not even be regular, but you don't really have a handle on it if you are. And I have memories of not being able to pay attention in class because when I went to the bathroom and realized I'd started my period, I didn't want to be late for class because, God forbid, I was a goody-goody, right? So instead, I'd MacGyver a solution out of toilet paper, and then I'd sit there in class thinking about whether I was going to be embarrassed when I stood up, instead of thinking about the really important material my teacher was providing me. And those kinds of situations are going to be prevented because we've given girls this access in their stalls or in their restrooms. And I also just encourage anyone who's watching and inspired by these steps the school district is taking to talk to your own workplace about the need for this too, because adults also have periods and everyone should be equitably accommodated. So thank you very much, and I think we're all around for questions at the end.